All right, we're live now. No one say anything bad. All right, so Anna's going to help us take a lead here. I'm not really big on, we want to stop, do a little timeout, ask questions. This is the process, but we're going to literally go together as a group through the whole process. If someone wants to come up to the field, be my assist, we'll go up to the field, we'll drape together. But literally, I want to do what we're going to do for the final evaluation, just kind of talk you through it. So we know it's a laparoscopic, right, appendix appendectomy, right? So with the possibility of going open. Yes. So when you walk in, let's say Anna's going to walk in, right? See how I have stuff lined up, right? Yeah. I got my Bobby on the end here. I got my suction device here. I got my laparoscopic tower. We're good to go here. I know my table is going to be over there. I know my ring. So you design where you want it. And that's what I want you to do, because I might have this thing all everywhere. Right? But also I want you to come in, look around, make sure you dust damp. Even if you're just verbalizing, that's fine. But if you just come in and start open, I'm like, okay, you missed that step, right? -4 points. No. So those are things I'm looking at. Any questions there so far? Because I have a habit of just diarrhea coming out of my mouth. So again, we establish what needs to be open. This is your field, right? Let's say you're working with Anna on that evaluation process. You're going to have that little preference card I gave you, kind of stuff I have on here and here. You want to verify what needs to be open by just laying it on the table. So I'm going to say, I'm going to call you Paige. I'm going to call you something else. Paige, so I'm laying stuff on the table. I want this open. I want my Trocars, 2 5s, one with an obturator, and whatever's on the preference card for the sutures. Today we're going to open 3 silks and 1 tie. We'll open that. We want the stapler gun open. You got the other trocar. If we had a 15 blade and a 10, right, that's what we have. I also want the 3/4 open. I want the drape open. This is the doctor's gown. Don't worry about the chromic. And you got 2 15s or a 10? Where's the other 10?
Oh, you said 15.
And a 10.
You said there was over 10, so get 15. Just get 15.
Hold that thought, camera.
Hold that thought.
Sorry. I need the 10 for that. I'm shocked by that. Yeah, we got tons of 10s. Okay, we got 5 people. It's more 11s though.
He's gonna go to end. So I messed up.
Yeah. It's 11s. So we have 15s. We want typically. Yeah. Not a big deal. Hey, no dancing. So, reason I'm having a 15 and a 10 because you use laparoscopic for an 11 blade. Don't be joking on me. We need 10 if we go open. So we need to have both of these. So we need to have a 10 and a 15. Since we have no 11s, I have to go with a 15, right? And these are for your other cases. So good. We established what we need to be open. We're taking our little tote over here. Oh, what's that?
If we're open, it's 10.
Sure. Yeah, we're going to start off with laparoscopic. So that's going to be an 11 blade because that's good for trocar placements when we switch over. So I want you to load up an 11, load up a 10 with the idea that we need that for going open.
Sure.
I would always do that in every case. You're always going to get a little 10 blade in your pack. Just load that bad boy up. What are you going to do, right? Throw it off the field and go to our school for donation.
Yeah.
So any questions so far in this approach, right? Pretty simple. It's all about coming in here, ready to go. And now we need to open up 3 trays. We have our major general tray because we're a possibility of going open, and we got our laparoscopic. We have a tray that needs to go to the field, and this needs to be open, and we'll go through that motions and also brought to the field. In that tray is insufflation tubing, camera and light cord, and that's probably about it, right? So those are things we need for this case. I know there's more to it, and the tray's right here. So we're using this tray for the general tray. But also, when you do your evaluation, I want to make sure you have this available. So when I come to do a count with you, I want to base it on this. So when I do my first count, I need to make sure at the very end I have everything. And I want to put you through a roller coaster of emotions. That's fine. Yeah, you'll be fine. But keep this in mind, organized chaos. Right? Making sure that you're organized through the bad moments. Doesn't mean you have to go like a bat out of hell and shit's everywhere, right? Make sure you're getting it to them, you're keeping your stuff clean, keeping your Mayo organized, so that count at the very end is not chaotic. And I'll know, trust me, I've been here like, when I've done it and it takes 10, 50 minutes to do a final count, it's just, they're everywhere. Yeah. And I understand that's hard, but I want you guys to be thorough. Boom, boom, get to that final count. Go through that motions. I do a final count, and we're done. But we're going to walk through it together, okay? So I want to mask up. You guys don't really have to mask up right now. You're going to be my assistant. You're already masked up?
Yeah.
All right, good. Anna, you ready to rock and roll? Okay, so what I want you to do is, when you get to this point in the evaluation, I'm like, Anna, any last questions before the world falls apart? Anna, yes.
Be Anna real quick.
Yeah.
You put all the stuff right there. We're not supposed to have it right there, right? We cannot have that there. It has to be. I'm talking about for our final. So where should I leave it in the blue?
So why can't we have it on the bed?
There's a patient right there. You can't leave it.
Okay, so that in the real world, patient would not be there.
Yeah. Well, I know, but we still don't have it there.
Okay.
There's no bed there in the real world.
No bed in the real world.
They brought it in.
No, they transferred it onto the table, remember?
Yeah. Okay, so let me just say, sometimes it's on a gurney. And 99% of the time, there will be a bed in the room. That doctor was doing surgeries right off the gurney.
No, he didn't. He didn't do it off the gurney, did he? No. There was a bed. It was just not in the middle like this.
No. What they did is that whatever the bed they're in on PACU, they'll come in and just do it right off that bed.
Oh, so they did.
They did.
And there was one that was folded up.
The retraction.
Yeah. Good question.
I know, see, because everybody's confused. So do not put it there.
No, that's not what I said. So what I'm saying is, what I want you to do is, normally this patient's not in the room. There will be an OR bed in the room. I want you to establish, for me, what you need to be open right on the bed. I can't move the patient and put the patient back. I'm not going to do that.
Just want to make sure.
Yeah, no worries. You got it. And then make sure that this is established. If I'm working with you, I need this open to my field, but give me a second, I want to throw in. Right? Okay. And then you need to communicate, hey, where do I want stuff? And whoever's passing, I'm also looking at your passing skills too. Okay. Mm-hmm. So I'm kind of looking at you a little bit on that, because everyone's going to play a little bit of a role in that. Okay? Okay. So, ready to go? Circulator, I'll be the circulator, and we'll have someone here to open up your stuff for you, okay?
Also circulators.
Okay. Let me backtrack about 9 months. So a circulator is, I'm trying to elaborate to you. A circulator can be a nurse in the room, which is typically going to do the timeout, right? But if it's just me and you, and we're both techs, and the nurse is off doing the patient, we need to get this field open, right? Yeah, that's what we've been doing for the last couple months now, or at least 3 weeks. So we're working together, right? Right. Don't be nervous. Don't be nervous, because if you think this is intimidating, all right, you can take offense all you want at this point, because at this point it's what do we got? 5 weeks here, 4 weeks.
4 weeks.
So you can think I'm just trying to confuse the hell out of you. The bottom line is, if you don't know what a circulator is over a tech, that's a problem, right?
I didn't know it was going to be better.
No worries. So I'm working with you. So the objective is to get this field open up. Okay? That's what we're going to do today. Is she choking? Do I have to call 911?
Your assistant's fine. You just had a little bit of something like that.
At this rate, all of you are going to be walking out the door. I'm like, all right, that's easy. I'm done. This Paige will be the only one. I'm ready!
So you want me to start with like the beginning?
From the beginning, right? No?
For right now, we're going to open this field. In your final evaluation, I want you to establish, coming into this room, bringing your case card in, right, and looking around. Do I have my table? Do I have my ring stand? Do I have my Mayo? Right? This is your field. This is your thing. This is how we do on a daily basis, right? You can't just come in and start opening up, oh, I don't have a ring stand. Well, that's on you, right? So if your ring stand's down the hallway, or if it's not in the room, or if it's over in the corner, why don't we just get it ready to go to be open? That's all I'm asking. And then walk around and make sure there's no blood on the walls, make sure there's no water saturated anywhere. That's called dusting. You're looking around for any dampness. You're looking for any dust. If something that's dirty, we just got to go clean it. We'll get a sand wipe and clean it. So eventually when you establish, and I'm working with Anna, I said, what would you like opened? This stuff here that we established off of our preference card. We read the preference card. It's very basic, right? Pretty much this stuff here, right? And as soon as you're ready to go, you say, mask up. And then that's what we're going to do now. You ready? Yes, ma'am? Okay, let's do it. Put your mask on. Let's do it.
So,
I guess. And it came up in the nose, yeah. I do.
All right. So who are you going to help her? So you guys as a team, what I want you to do is she needs to get that field open up, and we start opening this stuff up. So you can help her get that basic pack open. So as soon as she's ready to go, let's go. So when I do this evaluation, I want a little sense of urgency. I don't want to be like a bat out of hell, but I don't want spending 20 minutes to decide if we're going to open a basic pack. Preceptors are like, get out of the way. Dude, I have to get going here. Right. I got 10 more cases and I'm on call. Yeah. So do you know how to open this? Like, okay, if you don't, you don't. All right. Now remember, just take this pressure and just think simple. Don't worry. I'm just trying to fluster you, but you need to work it. So be careful of that back wall. So either you have to move that table back a little bit further. Be aware of that. All right, good. Now we have a sterile field. Outstanding. It's rock and roll. It's a great time to save a life.
Yes.
So I'm just going to stop right now. That's fine. You're doing great. I like this. For my sake, for my evaluation, I want this to be the last thing opened up by your partner.
Okay.
Reason is because your objective now, as soon as you establish a field, you need to say, hey, Zoe, do you mind opening this stuff up for me?
Okay.
And you get your gown and get in there. As soon as you're ready to go, you're going to open up and check the filters, and then you can grab it. Reason is, that's open now. It just sits there in no man's land. And things, and the rep comes by, oh, what's that, you know? So, but I know you've been trained to open it up before you go in. I know that. But you have to think outside the box a little bit, a little common sense. If we're working together, I'll open this up when you get in there, okay? Does that make sense? So as soon as you got that, so your next goal, Anna, is just to open that gown and get into that field. So I'm looking at that. Be careful. You have to be aware of your surroundings. You can't come close to here. So, I mean, you have to, like this thing, if I touch this or go near it, if you went like this and someone said, hey, you're way too close, they're going to say, just break this whole thing down. And it's going to be, I'm just telling you, this is what they're going to do out there. You need to be aware of your surroundings. Walk on eggshells if you can. Come here, get that gown open, and when you come back, be aware. See how you have to maneuver around here? And if that was open, that would be problematic, right? So that's why I want to wait till when you get in there.
And we have to put the instrument case on the ring stand, like on our ring stand, and just leave it there unopened.
So I'm a believer in there's two steps that you're trying to avoid here. You can do that, but you want to get a cover on there, right?
Yes.
So that means you're going to have to get your tray, and then someone's going to have to take the tray. Why can't you just bring an extra ring stand in?
Okay, that makes sense.
Right, and then as soon as she gets in there, she can just, boom, Mayo, ring stand,
Okay.
reinforced.
Okay.
Yeah.
We're at SharePoint.
Well, let's wait for her to get in.
Okay.
So Anna, is your thing to say, hey, when you're ready for her to open up, let her know. I would wait for her to get the reinforced on, okay?
Okay.
And then do it.
Brad, we're at SharePoint.
Sam,
Sorry.
let's hold the questions. I know you only not about short, but only about this situation. I still like you. I'm not trying to be mean, okay? We'll see. Good job. All right, this patient's in PACU. We got to get this room set up. So we have an appendix surgery, exploratory laparotomy, possibly going open. A lot of adhesions, so we need to get this count going. Okay.
Here. Here. That's why. Oh my god. We know that's contaminated. That's contaminated. Get in the book. 7.5. Yes.
So I'm just going to let you know when stuff like that happens, just get new stuff. Keep your conversation and emotions to a minimum. Not all, we don't need to know everyone in the world. No, we just fucked up. Drop gloves. Let's go get some new gloves. I'll say, oh my god, the gloves just fell to the floor. I'm retarded. No.
Is that okay?
So what's okay?
The gloves. Where do we end up?
What do you think?
No, it's not.
No, okay. So the objective is to try to get around here. Don't worry about new gloves. No, I'm going to waste them. I don't want to do it. So make sure if this happens during your evaluation, call yourself out, and then we're just going to move forward. Okay? I'm not here practicing getting gloves to there. Okay?
Fair enough.
Should have. Otherwise, we'll go through 90 gloves. Those days are past. Anesthesia looking in the window, wondering why the case is not set up. Good job. So on that, Zoe, I love how you do that, but on my evaluation, I want her to think that process through, and I'll correct that. But I love it. But you need to know that, Anastasia, that why weren't you spinning? Okay, that should be a no-brainer at this point. Most common thing missed, but if you miss it on your evaluation, right? What size gown is this? Is this extra large? Okay. No, I just want to make sure there's no, as they say, your ass hanging out. They don't like that. They want to make sure it's covered up. Do you have eyewear by any chance that you're going to wear during this evaluation? So we need to make sure we have eyewear on. I know you're not having it today, but during some form of evaluation and out there in externships, it's required. And if I go out there and you don't have it on, I'll pull you out of the case, embarrass you, and get glasses. Okay? So wear glasses, not your personal ones. There's disposable ones that go right over top of it, okay? Watch that back wall. You need to move that table a little bit out. There you go. Anna, you're doing great. But do you guys see how many times she moved that basin? Preceptors are very aggravated. Wherever you're going to move it, it should be one time. So what does that mean? Maybe get the 3/4 on first and move it right to where it's supposed to live, not to the Mayo, to the back table, to the ring stand. That's 3 steps, right?
That's true.
So that applies to anything you get to your field. More movements, more infection. The preceptors want to go exactly where it's going to go, and don't move it. Okay. Watch your back. You turn your back to the field. Make sure you turn sideways, okay? Got that? just referring it to Anna. So make sure, if you're going to give it to her, make sure that she's literally.
So was that, where would you like me to go?
Some rubbish.
Yes, all rubbish.
Yeah.
Organize little piles.
Outstanding. So if it's a difficult thing to get to the field, just have her grab it.
Oh, okay.
I'm telling you, you're trying to finagle yourself in there and you're hovering over a field. I would, listen, if I'm doing a revision and you contaminate my field and I have to get rid of every tray, not to mention you just delay the case for 3 hours. It's a bad feeling when you have all that stuff on your table and you contaminate it and now the doctor is delayed. And you're just sitting there like, oh, that sucks. And it's embarrassing. It's a bad feeling. So when in doubt, just have them grab it.
Here's needle.
So Anna, make sure we put a blue towel on that Mayo before you start putting stuff on there, okay? Because otherwise you're moving it twice. Now we got to move it back. Now you're putting a blue towel on.
Let's go back. When you are ready. One more. That's okay.
Did you contaminate yourself?
It was close.
So when in doubt, you think you did, right? So what you would do is get a new glove, right, Anna? If you're not even sure and you're like having any doubt, say, hey, I need a new glove. And get a double glove over top or take the double one off or whatever the case may be. Because that's what preceptors look for. They see it. And they're like,
I want to see if you see it.
you're like, I'm embarrassed, I don't want to say anything.
Yeah, but they
They'd rather you say something than not say something. Just suck it up and take it, right? Take one for the team. Yeah, contaminated. Break, scrub, get another gown, scrub, get back in there. Don't go hide in the corner and say, oh, Brad, I fucked up. You know, don't do that. Just get right back in there. Because you will. It's going to happen. And it happens to me every day.
Me too.
Yes, ma'am.
Three more to open.
Blade.
And that's all you did.
All right, everyone, let's, Anna, just take one quick. You're doing fine. Great. I just want to take a time out. I want everyone to walk over here. Don't worry about being sterile or anything like that. Do you mind just taking all this off real quick? I want everyone to please do this for my evaluation. If someone out there, precept land, wants to do something different, for my own shits and giggles, can you do this with your towels? See how it's all everywhere? Can you please hold that, Anna, please, and thank you. So can you please take one, go as quickly as you can to the end. All right, tuck this in, smooth it down. You can spin it. I want that fall below the field. Come up there like this. And then smooth it down as best you can. Okay?
So you want 2 towels?
Yeah.
Right. Yeah.
It's nice. 2 towels. But I don't want, when I say tuck in your Mayo, I want it where it's nice and clean. Okay? Smooth. I'm smooth it.
And it's still like, it's like prescription.
Alright.
Yeah.
Try your best.
I would.
And someone might show you different out there, but for my evaluation, just indulge me.
I wore this last night. You came over and said,
All right. See, got your 4 blue towels ready to rock and roll. Let's get some trays open. Let's start with our main tray. The general tray, the major tray, major general. So I'm just watching how you're standing here. You're literally like here with your back to the field. So how are we going to do this? You can move this out. There you go. So let's move this out of the way. And then obviously if you need to open it up, she can open here. But see how you're to the side opposed to where you're turning your back to the field? So now we're going to get this tray open. She's going to check the filter. You're going to grab it, check for chemical indicators. Entiendo?
So I check the inside indicator. Or let's check the middle indicator.
So just a refresher, right? There's indicators on the sides. They're going to clip them. You're going to look on there and see if they're black. That's the color codes. You're going to take that up this way, right? Not towards you. You're going to go this way, right? And you're going to check a filter. You're both verifying. Watch her first. She's going to check the filter. She's going to say no strike through, no holes. Now you're going to check for an indicator, but you can find it. You see it?
Yeah, I see your indicator.
Where?
Is that it right there?
That's, see it down there? So typically it should be like that, right? Yeah. See, and it needs to change color, which would be black. Now you can grab it. And let's get that shit over here. Oh, before you go, what do you else you got to do, Anna? She's got to check this one. Right. Don't go to your field, because if you bring that right to your table and set it down and it's saturated and it's got mildew like this, that whole field's wasted.
I start there one hole.
Oh, no. All right, now we're good.
Right, your camera's facing us. Stop facing.
Alright, I'm ready for panel. Alright, first me laps.
Laps, yes.
So here's the deal. I want to stop right now, okay? I want to make sure this tray is ready to go for a count, not like this. Is that you're going to count right out of there? Can you set up like I showed you? Please just indulge me and do it that way, because most of these hospitals are going to do it that way. Unless you're working in OB, they'll probably count right out of the damn tray. But you got like 10 instruments, right? These general trays need to be ready to go, organized on your stringer, out, count, ready to go, because that patient's coming right in that room. Okay.
You said to do that, you suck the quarters in the manual.
Yeah. So does everyone want to see a towel roll real quick one more time, or are you good? Okay.
Yes, please.
Anna, can I show? You're doing great.
You want to tell me?
Looks like a flimsy. Let me see. That's not bad. It's actually pretty good.
Actually pretty good.
Okay. But is it going to hold this?
No.
Right. So I usually judge it on the towel roll of how big this stringer is, right? Because you want good room on the ends. Because watch, if I put this on here, it's like hanging off. It's going to fall off the edges, right? So that's how I judge mine. So Anna, let's redo it again. Maybe what I can do is just let's do halfway, right? That's good. And what I normally do is you probably want to have doubled up. I'm sorry. Double it up, right? I thought you were giving that to me.
You can have it.
So double that up, right? You can either have, sometimes you have white towels involved. So go ahead and do that. You were doing it perfect. Show me. So probably you want to go like maybe not so in, just perfect. Yeah. And then get really tight there and just keep going as tight as you can as you're going up. Tight, tight, and roll it like a burrito. And then smooth it in. Like, yeah, so like, you know, like roll it. There you go. Roll it like it's a fatty.
Yeah.
Does that feel really good and firm on there? Erase that. Erase that. All right, put that right here. Yeah. Yeah, good. All right, you can go with your stringer now. Go. All right, then lay out your stuff properly so we're getting ready for a count, okay? So when I say, are you ready for a count? And if I don't see this, I'm just going to go with count. I guarantee it's going to be a hot mess. You know, and then eventually you try to leave this the way it is all the way through the case, so in the final count, it's just as easy. All right. Here's our, and I'm going to show you that. You're doing great. I get my PSP is, your objective is, let's take everything out and lay it right here and then start laying it, right? You can't be trying to organize on top of things that are in your tray, right? So just, boom, get everything out of here, lay it right here, everything. Take everything out, feel it around, make sure there's nothing around. And then start laying it out and then laying your forceps, right? Outstanding. Traumatic to non-traumatic. I usually make sure they're facing outwards. It's a lot easier to come. They're facing that in that way. Do you see what I'm doing? I have a preference the way I want it.
Yeah.
Is it the right way? It's my way.
Sure.
And when you're out there in the preceptor, you need to respect that. Yes, ma'am. Yes, sir. No problem. I got it. And do it, right? You might go to another room. It might be different.
Yeah.
No problem. Got it. When you are hired, you take little things and make it your own.
Yeah.
So, but you need to be respectful of what people want, right?
Right.
Otherwise, they're not going to teach you anything. You can't say, well, so-and-so did that in the other room. That's not look right. Go away. So I would just lay these right here. Those little sands. Yeah. There you go. And the little ones I would just lay next to the rake and sand so they're easier to count. Yeah. There you go. In the full section, make sure it's separated. Outstanding. Because if you lay that in there, one thing, if you lay the rake underneath there, it's going to be hard to reach for it. So if it's a common thing they're going to use, just lay them so they're out here. You're good to go. Trying to lay that under. Now, is that easier to count? To me, it is, right?
Yeah.
So let's go with a soft count and then jump into the... But I want you to, during your final evaluation, we're going to go through a soft count. We'll write laps. I'll do that personally because I'll do the count. Let's go through a soft count, all the little things. We're not counting laparoscopic. And then we're going to jump into, just let her know how many towel clips in total, how many mosquitoes in total. She doesn't have to tell you the name, just how many in total. So I'll say like this. How many towel clamps do we have? You'll count 1, 2, 3, 4, 5. How many mosquitoes? 1, 2, 3, 4, 5. Okay. I know you know the names, and I'll know if you don't when you get up to the field. But during the count, that's what I want you to do here. Okay. So let's go ahead and do it.
Okay, any laps?
Yes. 1, 2, 3, 4, 5 laps.
Face mix?
Yes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Cottonoids?
No cottonoids.
Needles?
1, 2, 3, 4 needles.
Now that tie is not, you don't count the tie, just the needle. Right? So
1, 2, 3 needles. I know.
good.
Blades?
1, 2 blades.
Hypo?
1 hypo.
And both?
1 bogey.
Perfect. Then, perforating towel clips?
1, 2, 3, 4.
Non-perforating?
1, 2, 3, 4.
Mosquito?
1, 2, 3, 4.
Kelly?
1, 2, 3, 4, 5, 6.
Great Kelly?
1, 2.
Critters?
1, 2, 3, 4.
Alice?
1, 2, 3, 4.
Babcock?
1, 2.
Console?
1, 2.
Right angle?
1, 2.
Punch stick?
1, 2. Miss.
Needle holders?
1, 2, 3, 4.
Scissors?
1, 2, 3, 4 scissors.
Tissue forceps? I'm sorry. Yeah. Tissue forceps?
1, 2, 3, 4, 5, 6, 7, 8.
Knife handles?
1, 2.
Suction?
Pull 2 pieces. 1 card.
Great.
3, yep.
Retractors?
Tractors. 1, 2, 3, 4, 5, 6, 7, 8.
Outstanding.
How many?
9, 10, 11, 12. 12.
Thank you.
Outstanding. Can't,
Good job, Anna.
and I grabbed that, give me that one suture reel. I don't want it. I want that silk tie instead, or that tie instead. That's a suture reel. I don't want it. It's terrible to use. So those are your ties, right? All right, so you get to this point, right? That was stressful. We got to it. You've done it 100 times. Now this is a little different here. There's 2 things we got to open here, though, right? Where the hell are we going to put it on our field? Right. So what I want to do, right, right now you get to this point, just lay this little packet and just lay it right on top of your tray temporarily. And I'll tell you why. I have a method to my madness. And leave it there. Now I want you to try to open this and this to her. So Anna, this, don't turn your back. This is going to be open, and tray is going to go vertical. You're going to lay it right here. Okay? So here, you never did this before. So when you open these,
It's just like on the table.
so open it like your gown. Back, left, and right, and then three. And you're not going to touch anything else until she grabs it. You need to check for a chemical indicator, right? And then you're just see it right there. You're good. And then you're just going to grab it and back off. And she's going to check. I'll show you. Go ahead and grab that tray. Grab these. Indicator's good. Right, back out. Before you put it onto your table, you need to look around for any holes or perforations. And you can't put it on your table until they say otherwise, right? Because that is a woven material that needs to be clean. All right, now we just go to your tip.
And then this would get thrown away, or they would use that.
They'll throw it away, but don't do that. So right now, when you get to this point, this is in here is what your insufflation tubing, right? Your light cord or your light cord and your camera head, right? So right now, what I want to do is we got our bovie. So think about this. If it's laparoscopic, we're probably not going to use the bovie. We're probably not going to use the suction because you have a suction here. This is only if we go open. So I'll just leave it here, right? I probably would just put these on my Mayo. Just go ahead and do that. Now I want to take this insufflation tubing, right? And I start thinking about what I'm passing all of these off. So I want to make sure there's no knots in them, right? So then I'm just going to lay them in here, right? As good as I can. We got our light cord. That's also going to be passed off. You know, if you want to get these knots out of here, it'd be great. Make sure it's as easy as we can to pass off.
So basically anything being passed off.
There you go. You got the idea. Reason is I was always trained, and I like you guys to do this, at least for me, get what needs to be passed off, because when we are ready to go and you drape and the assist says, all right, I want to start doing these, you can just bring this all the way up. And they can just start passing stuff off, right? It's a lot easier. I have a lot of people trained just throw everything on the Mayo, and that's probably what you see, but this is the way I do it. I do a lot of GYN, I do a lot of Da Vinci, and it's a lot easier to get all these things passed off in here, and I would have that a little bit more organized. And last but not least is your camera head, right? Good. Now you can put your drapes right on top of here, and you can get that thing right off your field.
Including the doctor's gown.
Everything, just lay it right here, because that's the first. That's the first thing that's going to be used. Outstanding. So you're good to go. We have everything ready.
And it's okay that it's hanging?
It's not below the field.
Okay.
So it's not. If it was like this, right? Typically, anything below the field is a bad thing, right? That's how I would want you guys to do that. Now I can get that tray off your table. You can pass it to your circulator or your assistant. Good. We have one more thing to get to the field. Is that lap tray? It's right here. So go ahead and we'll get that on this. Make sure you open stuff off of a ring stand. Make that a habit.
Here.
Outstanding. Don't worry about taking that filter out. At least go through the motions.
It's checked. Good.
All right. What are you looking for, Anna? Nothing? Is that what you said? Okay, good. We need to get there. Take that tray out and lay that, like I said, vertically.
And then
There's no filter in there. You still have to check for condensation. Very good. No water. You're good to go. And you lay that right up. Perfect. We're looking good. All right. So now we get to this point. That wasn't too hard to get to this point. Pretty easy stuff. Communication. Making sure we do that properly. We got our drapes. I'll look at that in a minute. I think they're out of order. But now we have to have the setup. Well, I want a 3/4 first. Why is the 4 blue towels? Yeah, so we know the first thing is going to be the gloves with the doctors. Then 3/4. This is going to be after the 3/4. This is what the doctor is going to use when he comes in. Then we're going to put a down sheet. Then we're going to square off, and then the tray. That's what I was trying to, right? The reason I do this because this is how they're going to ask for a CST exam.
Right.
What is the order we'll put the drapes in? It's always the assist on top. And be honest with you, just to be anal retentive, this needs to be like that because we need to put the gown on first.
Right.
Right. So looking at this, Yes, ma'am. So looking at this, we have Trocars. Did you load up your 10 and 11? Can you do that for me? Take the stringer off since you're done with the count. Please and thank you. And you can hide that wherever you... Be a little gentle there. Everything just fell. Yeah, I mean, we're not doing it today, but very good point that Sam said. When I do evaluation, when I do it, we'll go through medications, we'll add it to the field. For time purposes, I want to get to the point where you guys want to see. I know you need to get medication. I know you had to do that. We'll label and we'll do that properly. Good to go. Load those blades up. We'll see. I need a 10. I need 11 on that Mayo and a 10 in the back table.
11 on the back Mayo.
11 on the Mayo, 10 for when we go open. So leave that on your back table. Right. So if you are lucky enough to have one of these, we'll lay that right there, right? Because we'll use that. But first thing we're going to use local, right? And a pen. Oh, okay. Loading sutures up. Okay, just load one up. Don't worry about that right now. So we got this. Look at this order I want you guys to put this in, right? We're going to do local first. We're going to put a blade in, right? Do a blade. The first trocar, I guess we just have one arbitrator. That's fine. Oops, and it's broken. We're going to put the first trocar in, right? So local blade trocar. When that arbitrator comes back, we put it on, right? Again, local blade trocar, local blade trocar. And we're using this same arbitrator for each one of these. Make sure this is off, right? This is on. Make sure it's off, right? So air is not escaping. In this case, CO2 in the belly, right? Right? We forgot one thing. Local blade Varus needle first. Local blade trocar, local blade trocar, local blade trocar. Right. This is going to be passed off. This is obviously for the end of the case, so I don't need it on the Mayo. We can just leave it back here for temporarily. So what else I want to grab is grab that blue 530 scope. There you go. And I want you to make sure you check your equipment. How do you do that? Do you remember? So I'll show. There you go. You're looking in there, making sure there's no cracks, and you kind of look in there and see. And if you are good to go, just lay it right here. Grab me those three graspers in there. Dealer's choice. Okay, bring them on up over here. We're just going to lay them as comfortable as you can, so we're ready to go. I'm not really testing on what they are. I just want to make sure we have some graspers for you guys to practice with. We got a right angle. We got a two debakies, right? Good to go. All right. The only thing we don't have is a anti-fog solution. I'm going to go get that. So does, I'm going to show you.
That little white thing.
You know what it is? Yeah, it's in a little peel pack. You don't mind. What questions you got? This is pretty good. Now I'm looking at this. I'm okay. You're good. You're ready for a count. You're organized. Also, on this laparoscopic case, let's start off with two Retracs up here, and then give me two perforated talc lamps. Reason is you might use that holding the skin and push up on it. And if there's bleeding around there, you want some Retracs, right? Perforated. I apologize. The sharp ones. Sure, take this. Yeah. So when you put instruments, just click it once, right? And have it here. Oh, this thing's broke. So does everyone know what this is? Yeah. So go ahead and just load this up on your 530. Don't turn it on until the patient comes in the room, right? What are we missing? Anything else? Looking pretty good. Now eventually we're going to change over to go open, and I'll show you that, and I'll probably do the process for that. Okay. What questions do you have here? You got sutures. Now your ties. Do you have an extra blue towel? Make sure you have extra blue towels, right? Yeah, please. Just Have you ever set up ties before? So these are, yeah,
Name in there.
you haven't? Yeah, I'll show Anna. Unless you want to show her first. So look at these. These are kind of small. These are 0 vicryls. So go ahead and set that up for her. And if you want to hold on to this just for label purposes, make sure we know what it is. They're probably going to be small, but
Because you lay them in there, right?
let me see something. Maybe you know, on these, you know what I used. You know what I used to do with these? I would just have this, and give me a towel clamp real quick. So let me see if I can grab these out. They're kind of hard to get out. Non-perforated. It's just.
Sorry.
If you ever get these vicryls, it's probably a little different than the silk. I used to just go. Oops. Man, these don't flip. Give me one that works. So when you want to bring it up to the field, you can just have it and they can just grab it from there, right?
Oh,
You just grab them. And if you want to grab
they're
this,
shorter too.
yeah, they're short. They're probably used for many other things. Yeah.
Yeah.
So load this up on a tonsil clamp. Thank you very much.
I'll keep these just in case you.
Sure.
Okay. Thank you.
So have your ties ready to go, right? That's so. Why are we doing this? We're anticipating going open, right? Have your ties ready. Have one of those on a passer ready to go. So when we start the case, we don't have to hurry up and do that. When I change over, we got our ties ready. We got a tie and a passer ready. Call it a tie stick or stick tie. So I'm looking at all this. It looks a little. So make sure you. Let's say these are your sutures, right? Just put them all in here, right? And that's when you're going to load up, ready to go. You know where it's located. This is going to be in case we go open, right? Keep it where you're not going to be clunking into one another, right? Because if you went to go grab your blade, you get your suture in the way, whatever you're going to do, just make sure you're not clunked in together over on top of each other, right? Any questions so far? This looks good. How are you feeling? Good. Any questions so far? So what I want you to do is scrub in, get a gown, and get in there. We're going to drape, and then we're going to keep on going.
Just take a picture of that. Okay. Yes.
This looks funny. What are we doing here, guys? Doing a down sheet, right? That's why are we up top? You see this? You just contaminated. So this is what I'm trying to tell. Make sure, I'm not trying to be rude, but this is the reality. If you're coming up here like this, just take it out, go away, right? That's just what's going to happen. So we need to either be aware of our surroundings and reach out a little bit and try to prevent you coming up here like this, okay? Okay. It's a very fine line between watching, going up to the field and watching your back, right? So go ahead, go. Keep going. Yep, drop it. Get up. All right. All right, so the objective of that was to try to get this as the operative field. So when you, I know it's, you guys didn't know, but when you are doing this, use the prep line as a guide. So the prep line stops here. We need to make sure this falls about right here. It's okay if you missed the shot, right? You can't move your drapes. You can't move them around. That's just bad technique, right? For this case, we'll just leave it. When you're doing that, try to find a center point, right? You get one in, right? We open it up, we drop it. You don't have to move with the drape. Just stay right in the center. Move it, right? We got this in. We both drop at the same time. So we're just kind of moving like that. A lot of people like to go with it. They're like, hey.
Yeah.
Whoa. Hip hip hooray. All right, let's go. Three quarters. I'm sorry, towel penetration, blue towels. So what I want to do with you, Anna, is if I'm the doctor, but for you purposes, for the assist, I want you to go on that side, and she's going to hand all 4 to you, and you're going to square off, okay? Outstanding. You have all 4? Good. So do you know where the, so here's the deal. So we know, I just kind of said that this circle is where we're going to do our surgery. That's where the prep line is. Mm-hmm. So if you know that, you want to come in, right? And just try to guide it to where that line is, right? Right? And then try to go that as a window, right? Yes. You went like this. Right? Yeah. Hard to do surgery that.
There we go.
Good job. And we know we can't go towards the field, but we can go back a little bit, right? Yep. Outstanding. And you're going to see a lot of people just lay that on the other side from your side. I know you're saying, oh, never go over an operative field. But most doctors will just go onto the other side from yours. So
not go around.
So it's really hard sometimes to finagle, so they'll just go like this, right? Anyway, I know you were always trained not to go over your field, but just go ahead and do that for that purposes. You're going to see a lot of doctors do it that way. Because in reality, you've got a barrier here, over here, so just get it on that side. Now we'll go with the drape. We'll take the stickies off. Excuse you. What is that, Ren and Stimpy? 7 hours later. I think Ren and Stimpy had it before them. Back in the 90s, they stole it.
7 hours later.
That's the name of my dog, Ren and Stimpy. They look just like him. One's a little like rat looking, the other one's like a big. It's like that. Yeah. So I'm looking at you. Just did that.
I know. I wasn't.
You know you knew it. Okay, don't do it. Drop it to the damn floor.
Is it top to bottom? Third to left?
Let's go with laparoscopic or the anesthesia first. Yeah. And if this is in your way, Anna, this is what I want you to get your voice. Communicate to me. If this is in your way, can you say what? Hey, do you mind moving this monitor out of the way? They're human. They're not going to bite your head off all the time. So if you're concerned about this, say, hey, can we move that out of the way? And if you're concerned about that and there's no one around, just let go. Good job, Anna. And this is another scenario where you should move with the drape. You just go out with your arm, right? And just drop it over and make sure it extends over the toes. Just kind of come out like this way. Yep, perfect. And just drop it, drop it. All right. So the only thing here, if you look at that, our anesthesia is effing you up here. So be careful. Hey, anesthesia, do you mind not pulling the drapes on too high? Can you lower them down for me, please, and thank you? Because what you're doing is we have no operative site now. So we're like, where the hell is the hole? Right.
Okay.
So can you move this thing up a little bit? And I'm going to direct that when we do that, okay? We know if that happened, we have to get the whole damn drape off, okay? So when we're doing that, I'm going to help with that process because let's be honest with you, when you're a student, you're going to be doing it with someone. You're not going to be doing it on your own. But we cannot pull the damn thing off the operative site, right? All right, good. So get to this point. What is your question? I'm going to slow down. Paige, question so far? Anna, you had one? Okay, good. Can you see yourself doing this process?
Yes.
It's not hard, right? Do it. Can you do it perfect?
No.
Okay, that's what I want.
But we're going to try to.
We'll try.
Nobody's perfect,
That's
but
all.
we'll try.
All right. Try for perfection.
Yep.
That's it.
I'm trying.
You got your little thing on now? Good.
I did.
All right, don't be talking crap.
I'm not.
All right. So you get to this point, right, in your evaluation. I look at Anna. I said, Anna, what is your instincts? What should you do at this point? And what would that be?
The ring stand back to the Mayo.
Let's do it. You grab the ring stand and bring it out on this side. Your only job at this point is get comfortable. Bring it up to the field. Bring your tail up. Just get comfortable for surgery, right? And I will help at this point. You can leave this over on the table for when I get in there. The actual, I apologize.
I'm chewing the hell out of this down
Sorry.
right now.
So, chest guard, come on over. You're my nurse.
Circulator.
Zoe, you're going to start passing some things off here, okay? Very good job moving that table. Where are you going? Why are you going like this? Just come.
Moving it back here.
No, you're going to be on this side. So I want you going this way. Yeah, no worries. Right, so come on in. So you're going to be working here, and you're going to be giving. I'm going to be on that side as the doctor, and you're going to be giving things to the doctor, right? So move this way a little. I know Chrissy showed you to have it in the middle, but in reality, it's a lot easier to work just like this.
Mhm. It is.
Right? I can reach everything from here, and I'm tall and I have long arms. But if it's like this, I'm gonna be bumping into it. I don't know. It just
Yeah.
seems awkward for me.
Yeah.
And most techs that I know, and I'm not saying anyone's different, will have it like a L scenario where it's like this, where you're in control, or maybe more of an angle, right? So all your job is to do is just look pretty, sit here, and I'm going to be working with her to pass things off. You can help by maybe getting light handles on, right? Jessica, can you help me? So here's the deal. I want you to, when you get to this point, I won't evaluate you on this, but I need this done. So we're going to go with the first thing on top. It doesn't really matter. Your objective is to pass to the chest guard by swinging it to her. You're going to. Very good question. This is the end that's going to go into the laparoscopic machine.
Mhm.
All right, so that gets passed off. Well, make sure you have enough slack to get to where you tie it off here, and you're going along here.
Tied in here. So.
Right. So that was what I was saying before. Keep your knots out of there, right? Because otherwise you're looking. Right. Very good, Anna. Keep busy. Light handles. See if you can help. Good. Just be aware of poor chest guard here that's not sterile.
All kinds of samples.
Okay. Yep. Are you comfortable with your field? You know where everything is. If I ask for anything on your field, you know, right? Okay. That's what your job is. Look around. Anticipate. Okay. This for open. This is where you can grab irrigation. Right. All that stuff is to anticipate and know.
Okay, now put all this going up.
So I'm going to show you one, and you can do the rest the same way. So I'm going to, when you get it right, you want to make sure you have enough slack. I want to tie it down here,
Right, yeah.
and then I make sure it comes here, tie it here. Right. Good. So now I have for the Trocars going this way. I want you to do that light cord, and then the insufflation is a little different. We do the light cord the same way.
Maybe we took it out early.
So right there, do you see the red? Do you see the red dot on there? Find the red dot.
Red dot.
No, keep no. On the thing, keep spinning it.
Right here.
Now match that red dot up with the other red dot.
Ah, there you go. Oh, nice.
Cool.
And so the one in your left hand is going to stay with you. The one in your right hand is going to be passed off. So that's a good thing too. If you're not sure which end, just be careful. You're not bumping into this. If you're not sure what's the end to be passed off, ask.
Okay.
That could be the last dam. Is that the right end? That
The
it?
one on the left, right?
No, I said the one on the right.
That's all.
So make sure we verify, because that could be the last
This is the
dam.
right one, right? Here we go.
I'm not joking. You want to be the last and delay this case because you threw the cord off and they don't have any damn more cords. All right, that's how some the patient's on the table under anesthesia. Now we can't do it.
Where
Yeah.
does that one go?
Don't you know?
No, I don't.
I feel like you're working. Are you working at short point? So this, push that, push. Yep, yep.
Oh.
Keep going. Now this is going to turn it on. Put it off standby. All right, this is it broken? Interesting.
The hospital chief over this week.
It's on now.
Actually, like, the day
Oh,
after
standby.
switches over.
Oh, jeez. Lights on, right? Be aware of that. So
Yeah,
looking
it's
at
on.
that, be aware of that.
Could burn
Right?
a hole.
If you see that, Zoe, or anyone sees that, you need to make sure the lights are off. Off,
Yeah.
on standby. All right, good. Did that get in your eye?
That was really bright.
So, scene's overrated.
Steve's over.
Yeah.
So this is an insufflation tubing, right? This is what's going to get the gas for the. So this is going to be for you. That blue is going to be passed off. But this, I just want you to coil up here and also tie down. Okay.
Wait, you said don't toss it off?
Toss it off, and just plug it in anywhere you want, because I don't have a machine.
Okay.
Welcome to Southern Tech. If you guys are here in another year, I'm redoing everything in here laparoscopically wise. They're investing money, but it's
Oh, they are?
yeah.
I'm gonna come visit.
Huh?
I'm gonna come visit. See
Come on,
it.
visit. We're tearing down all these walls and doing everything.
Really?
Oh, that's awesome.
We're making this into more of a laparoscopic, because these are 1975 stuff. It's not fair, but it is what it is, right?
That's cool.
So what I want you to do, Anna, as you're waiting, you got. Don't worry, we're gonna wait till you when you go open, right? So leave that in there. Okay. So what I want you to do is see if you understand that. So I'm just gonna leave this coiled up here, because normally I do insufflation up top, right? That's
I
okay.
apologize, you said that.
So Anna, can you load up your camera and light cord for me? Let her do it. She needs to know it. Everyone needs to know how to do that, because if I'm sitting there at the field and you don't know how, I'm like, okay, that's not a camera and light cord. That is a trocar. And let you think it through. A good preceptor will let you think it through until it gets. That's a Varus needle. Put that down. Keep going. We want a camera.
Think about
Load
what's
up
the
the camera.
default for. There you
There
go.
we go. All right, now load that up to the camera head.
Good job.
All right, that's the light. There you go. I mean, now we're figuring it out. Now put the camera to the camera head. The thing sitting on the bed. Now, how does that work? Yeah, that's interesting. There you go. All right. Can you see how this can be embarrassing? Right. Now, it's in your interest, it behooves you to know how these things work prior to that doctor getting there.
Yeah.
If he says load it up and you go like Anna did, you'd be like, can you call someone in here? Very good. Now what I want to do is a white balance. So grab yourself, I know we're not supposed to use Retraction, but that's all we have. And grab yourself a Retraction, that's fine. Lay it on the bed, point at it. Turn the light on for me, nurse. Push standby. The top band is, no, that takes it right there. To the right, right. That little button right there. Hey, all right, good. Lights on, right? Now I want you to lay the Retraction down, point it to it. This is a little tight on this. Now I want you to push white balance, which is on the second one in the middle. See, it says keep going to the right, keep going to the right. See, it says white something. Push it, yep, and wait for it to say clear. Tomorrow. Yeah, we're good. Why are we white balancing it? Because you need to white balance all laparoscopic stuff, because when you go in the belly, red won't look red, it'll look brown. And if we can't see it bleeding, right? So good. Now you can turn the lights off, and you can just put that anti-fogger on. Or just put it on standby. Yep. Push it. Yep. Beautiful. And now lay this just down here, facing this way. I'll show you. That's awkward, right? Just like this. Because the doctor is going to use it going that way, okay? So you can just take it, when we're ready for the camera, we'll just go, we'll go right into the trocar, right? This is an anti-fog. We want to make sure. Why is it anti-fog? Because it's hot in the belly and it's cold in the OR. Has anyone seen their windows, the humidity level, it steams. And if you don't have that hot before you go in there, you can't see anything. It's all steamed up. So that's what. Did you just turn something off? Oh, that's in there, right? Yeah. Okay.
Yeah.
Thank you. Wow. Now, any questions so far? Pretty simple, right? This I'm not evaluating you on this. I just need that done, and it is a good skill to have, understand. But there's so many variables the way this is done. I'm not going to go down that road. The way people do it, the way they set it up, because it varies on trocar placement. But for your case, you follow directions. That's all I'm looking for. Now, I want to come as the doctor at this point. Now, you can go on that side because the doctor is going to go here, and you just get ready to play my assist.
Okay.
And now you are going to be ready to rock and roll, right? You ready for the surgery? Doctor's going to come in. You need to gown the doctor. And I'm going to walk around here, and you're going to gown me. Ready? Doctor, be right with you.
You gotta go rub his tummy. Clap them cheeks. Here he comes. Go rub.
Good morning.
Morning, Doctor. I'll be your search tech today.
Nice to meet you.
Running that butt out.
Can you move my hands down, please? Paige, could you tie me in, please? I appreciate it. I'll start with my right first. Outstanding. Good job.
I'm sorry, I'll be your first.
Nice to meet you, Zoe. You've been working with me for 30 years. That's me, not you. What crap? This is a big counter or what? Can you call the next room, get my patient ready?
Yes, sir.
Anna, could you give me a timeout? You tell me what case you're doing.
We're doing an exploratory laparotomy with the possibility of going open.
Okay.
And fire risk of 3.
Fire risk of 3, okay. Do you know what fire risk means?
I kind of explained it. It's like how, like the area of where it is on the body, how close it is to the face.
So you got 3, 2, 1. The closer you are to anesthesia gas, that's typically a 3. We're in the middle, that's a 2. Right? If there's intestinal gases, that might go up a little bit more on that. Very good. So now what I want to do is just looking at her thing here, right? I am going to have that trocar dummy over there to practice some things, but as of now, I don't have that. What I am going to do is we'll go a little bit slow here, and then we'll go through the trocar placements, and then we'll go over turning over, and I'll probably step in and show you how that's done, okay? But I want you to know the rhythm of putting trocars in. So the first thing we're going to do is put the varus needle in. I need local, right? So pass that to me properly. So get used to passing it, but also saying, doctor's lidocaine epi with 1%.
Okay.
Yes, you don't have to say that once. You don't have to keep saying it every time, right? Injection, local back. And I'm looking at things, how you load up. Make sure you're using one hand scoop technique. You're not using 2. Blade, please. So all this stuff,
Doctor.
there you go.
Good job.
I want to see the inner beast. Come on, let's go.
Let's get it.
Varus needle.
Come here with Doctor.
Outstanding. Good. All right, we got this. We'll hook up the insufflation tubing. And then I'll ask you, what is insufflation?
It's when we fill the belly with air.
Good. Is it air or CO2?
It's CO2.
Let me answer.
I am sorry.
So CO2. It's fine. So this is on. Good. Hold this right here. So we have, it's pneumoperitoneum, it's CO2. What is the nominal pressure it should be at? Okay if you don't know. Yeah, it's 12 to 15. Remember that CST. 12 to 15. All right, we're going to put the other trocar in. So there's a rhythm here. Local.
Blade.
Blade. Use one hand. Trocar. Can I have this little one loaded up? Put that obturator in there. I just don't have a blade in there. And I'll make sure you get the correct ones. This is obviously not correct. Yep, very good. You got it. Outstanding.
Charlie.
Trocar. Good. Ooh, love that.
I just tore that.
No, it normally sounds better in amputation. So, camera, we'll switch this over. Varus needle, I'll do that for you. Done with Varus needle. So when I throw stuff to the field, I want to make sure you just clean as you go, right? Can someone turn? Oh, that's right. Can I have camera on, please? Lights out in the room.
Am I loud?
No, of course not. You're sterile.
Damn!
Oh. Is this one right?
That one, right?
This one, Brad?
The standby button to the left, right there. Push that. All right, good. Outstanding. All right, good here. So go up. Outstanding. All right, can you hold this camera for me? Can you look? I know you got to turn a little bit, but hold it right there. Mount. Local. Right there. Blade. Trocars. Doesn't have an operator, put the operator in. Make sure you're doing that. Just when it comes back, put it right in the next one. Good. Off. Tear into the skin. Hi, Bradley. There you go.
There you go. Oh.
We're going to use the other one. I was just trying to get in. All right, good. Let's do it one more time. Hold that up. And then follow over here. No. That's hard. We have no insufflation in here, do we? And this is how it would look if we have low insufflation. It'd be like looking in like a cave, right?
Basically, yeah.
It's like, I don't see anything. So we got the point. We're going to go through the motions, put in Trocars, right? Since I don't have all the real names, and normally I'll go through the motions. I'll grab the instrumentations, do that properly. Then I'm going to ask you some questions. Do you know a little bit about the anatomy of the appendix? I'm just going to quiz you. What do you know? It's okay if you don't know anything now, but it's in your interest to do some research, right? Cecum, mesoappendix, artery supply. Yeah, when it's the catheter.
Artery.
So I'll answer a little bit. And so if you're out there in the field and the doctor turns to you and asks you a question, if you don't know, just say, doctor, I'm not sure. I'm going to find out for you, though. And just move on. Don't sit there and like, he got me. It's just kind of like, I quit. It's not a big deal. But what it is learn from it. If he asks you the next day tomorrow, hey, did you find some research on it? No, doc, I didn't have time. Well, he just says you have no interest whatsoever. That's his impression, or her. And that would be mine too. Because that surgery is his life. And surgery should be your life, for this is your field you chose, right? Shoot your crap. So, lights on. This is the point. I get to that point, I ask some questions. I'm going to look at you and say, there's a bleeder. We need to go open. Do we have the template already? At this point, I might give you a little breather. I'm going to switch roles and show you what I want you guys to do, okay? Lights on. You play the doctor. I want you to just literally just lay this down here. Make sure the lights are off. So where's my nurse? Turn lights off. Not you. You're there. I'll come on this side, doctor. You're now the doctor. And I'm just going to step in to show you, okay? And then you're going to step back into my place. So when you're here and you're the doctor, you said, hey, I'm going to go open. I'm like, oh, shit.
We're going to go open this later.
Okay, so I'm going to give you some time to think about it. So just start taking things off and laying it here. What I want you to do, I don't have a blue towel. I want to have an extra blue towel. Can I have that?
They're ready.
More blue towels the merrier in life, right? At this point, make sure you have enough of them. What I want you to do is, one, clean your garbage up. I want you to get a nice, clean blue towel here, right? Anything that's laparoscopic, I'm just going to gather and lay here. Anything that's a countable item, flip back where it's a countable item. So when I say go open, in the real world, he's not going to wait. He's just going to say template. But for me, I want you to clean everything up here and take everything off. All right. We don't need these anymore. Just put it back where you're going to go. It's about organization, right? All right. So we got our varicinated. We don't need that anymore. We don't need our local anymore. All right. We're going to have a blade, but we're going to switch over. Yeah. They're going to go right down the linear elbow, which has no nerve or vascular supply. I don't even feel it. They might do a tap later on, but in an open case, they want to just go right in. Right. So, and we don't need a pan because we know we're doing a midline incision. Clean slate. So what are we going to put up here? We can keep it simple and stupid for this case, right?
Achilles.
Okay. So here's what I used to do, right? And it's probably a good rule of thumb for you guys to keep organized. I go down. See how this is going? down the line here.
Mhm.
So I asked myself, do I need any towel clamps? All right, no, probably not. Do I need any mosquitoes? All right, let's just grab 2 just in case. But keep in the order of down here, right?
Mhm.
All right. What do I need anything else? All right, let's put up.
Kelly
All right, so let's grab 2 Kellys.
and maybe Alice.
Right. Now, I want quickly just kind of shut these real quick. So this is a process that you're gonna be working. You might give him the template, and you might be cutting. You might be doing this. I'm not doing that to you. I'm gonna give you time to set up. Okay. Now I put up some Alice's. Do it in 2s, right?
Yeah.
I just kind of do it in intervals. But I'm keeping it in the order of the way it's in the stringer.
Yeah.
So when you count, and you always keep it here, when you go to the counting, you just go along. So I got 1, 2, 3, 4. 1, 2, you just count with the Mayo, right? So, okay, then we got, let's put up some, what else? What else you want, Babcock?
Tonsils.
Tonsils. I'm not really caring what's up here at this point. I just want you to keep organized. I would say we definitely need some scissors. Let's put up a, I think you already had one loaded. I quickly grab my
Put it right in there.
tie. I'm going to put my ties up there for when you need it, in case you need to grab it, right? This is starting to fall apart, so let's get up a medicine bomb, the common scissors. If you go straight or longer or deeper, we'll add that in there. So I think we're good to go here. That's only for closure purposes, right? So straight Mayos are for sutures, so that won't be till later. So I just put up stuff immediately need to use, like a trauma scenario. So we got some things. Maybe in the beginning we want to go ahead.
How about that?
Right, very good. So we'll have some basic handheld retraction. Wherever you want to put this is your choice. Probably want to get that a little back. It's fine. This is your Mayo, right? So wherever you decide you want to put it, make sure you own it. I'm very anal retentive, all right? Very good. Let's start off with 2 laps on the field 2. Outstanding. Start off with some small retraction. If the incision gets a little bit larger, we'll change over to Richardson. Keep this simple and stupid, right? If you want to add some more to it, go right ahead. You got some ties. You got a tie and a passer. If you want to have this doubled up, got a right angle just in case. A medicine bomb's a common thing. The only thing I'm missing is some forceps, right? The most common forceps you're going to use is a Debrief. And I used to just leave it right there in case he wants to grab it. Add some with teeth is normally for closure, so I won't put that up right away. If you want something a little bit deeper with some teeth, maybe a rat tooth. So I start off there. Most common thing used, I'm telling you,
This what?
is the Debrief.
The baking. Okay.
For
That's what I
closure,
thought.
now this is obviously if you want to grab fascia, but for delicate
Debrief.
dissection and blunt dissection, this is the bad part.
Yeah.
Now if there's 2, like an assist and a doctor, just put 2 Debriefs up there. No, we have it. Probably not. We do. Let's put 2. Right.
The baby.
Now I like things, so I can control this.
Mm-hmm.
So if I give this to the doctor, right, that's a bomb, right? You throw it down, all right? Right away, I'm cleaning. I'm notorious for grabbing stuff. Doctor throws it down, okay, it lives right there. That's your home. That's your home.
Go to your home.
Go to your home. Ask for something else that's up here.
I need an Alice, please.
Alice. Oop, my bad. Alice, coming your
Do
way.
you know what you're doing?
Not really. Go ahead. I'm ready. My glasses are falling, doctor.
Debrief, please.
Debakey?
The
Yes,
baby.
doctor, coming your way.
Tie.
Tie? Tying a pastor, sir, or free tie? Yes. Right away, I'm thinking, okay, we might need a suture scissors because you're going to do it. Okay.
That, please.
Are you working here, assist? You want it at the tie or right at the end, doctor?
At the end, please.
Okay. This doctor, the scissors not working very well.
There we go.
Now I use it in the Mayo.
Those
It's up on my
suture
field.
scissors,
Do you see that go down there and see what the doctor's doing?
Kelly.
Coming your way, doctor. Give me 1 second. Be right with you. Kelly, coming your way. And I'm always organizing. I'm very anal, retentive. I like things stop moving around.
And I need Babcock.
Babcock, comes your way. Click. Trying to anticipate. He's grabbing that. Probably needs some silk ties, maybe. Right away, I didn't load this up, right? Now I'm screwed. Right. Not screwed. You want to tie in a pastor, doctor?
Yes, please.
Okay. Coming your way. It's my first day, sir. Or ma'am.
I can do
I know. Alright, good. Your turn. Oh, scissors? Alright, let's go. Rocking out. Let's put everything back. Scissors? Yeah.
Cut it
Medicine?
off.
Medicine bomb?
Whichever one's the
Yes. Yes, doctor. Oh, I'm short point. All right, so let's put it back. I want you to come up here and be comfortable. Do something like I just did, okay? Oh my God. Help us. So let me get all these instruments back up.
He's done for.
We never did an incision. That's fine.
He was already open. What are you talking about?
Yes. I'll play the doctor. Come on back. You're my assist. And everyone's going to do a roll here, okay? Do we have that count sheet, by the way? All right, good. So you're going to do a final count for me, okay? But only when I say. Only when I say. But not right now, because eventually I want everyone to kind of play her role, and then Anna's going to come back and do a final count with me to show you the final process, okay?
You're dying?
Where'd everyone go? You hot?
She said she's dying.
Too bad. We're scrubbed in. Get in here. Drinking soda and juice. Drinking in gin and juice.
I'm hypoglycemic. Sorry, I'm passing out.
He's so damn funny, bro.
Gandalf, the wizard. Come on over here.
He's so high, he don't.
Sipping on gin and juice. Lay back. Got my mind on my
I rolled a 20. I'm casting gin and juice.
Period.
That's a nerd joke, by the way.
You know, if it's coming from you.
Double-sided die. Are you ready, Anna? What's going on with your mask? It looks like it's literally about to just jump off your face.
It just runs right up.
All right, I'm concerned. Can someone put that down for her? Are you getting hot and tired? All right, good. Can you imagine 9 hours?
12 hours.
You're the contaminator.
It's the back. The top. Pull it back some.
Give me the shot.
Period.
Come on, Meredith from Grey's Anatomy. You ready?
Fat no
It's a
lollipop.
great time to save a life. All right, so we're going to go open. We did laparoscopic. You saw how I was doing. I want you to see it. Hey, guys, bear with me. I'm losing my
Yes,
mind.
no, we're good.
So,
Thank you. Yep.
you good?
Perfect.
All right. Anna, you ready? We changed over, ready to go open. You're comfortable with everything is here. And you're going to keep this organized, right?
Yep.
All right, 2 laps, please. 1 to the assist. 1 to me.
Oh, shit. Sorry.
So when you give this, make sure you give it to him open, or her open. Just open it up and say, doctor, here you go. All right? I would usually hold the blue part and give it to the doctor. All right. You're going to follow me. Kind of come up there. Can I have a 10 blade, please? We're going open.
Her.
All right. Can I have a hemostat, please? Got a bleeder here.
Oh, hurry.
Can I have a tie real quick? I got a bleeder. Free tie and a passer. Can I get a debakey first?
Shit.
Tie. Free tie.
Period.
This is not a debakey, by the way.
Oh, is that right too?
Can I get a tie and a passer, please? Debakey. Don't lose it. Keep going. Debakey coming your way. Debakey on a passer. Okay. You have one right there. Don't lose it. That
Tonsil, baby.
So this is a free tie or a stick tie. I'm sorry. This is a tie and a passer or a stick tie. These are free ties. Tie and a passer.
There you go. Good job.
You see the tips? Good.
Nice tied up.
Take that off. Scissors.
Oh my god.
Can we do that one more time? I got another bleeder.
Oh, shit.
Please hurry. What do I need first? I need hemostat.
Oh, wait.
Kelly. Keep organized. You're looking messy. Kelly.
It's camera.
Good. Becky, please. Good. Trying to pass her. Good job, Anna.
Good job, Anna.
Okay. I'm the surgeon. Let me work. Tips. Take it.
No, doctor.
This isn't permanent.
All right, so we get a Army Navy, please. Can I have a Babcock?
No, doctor.
Penrose in here.
And that runs.
Can I have a suture, please? Hold that just like that.
No, doctor.
Can I have an answer with teeth?
On the way.
Yeesh. Ashley, Ashley.
Stay out of that. Scissors.
Okay.
There's a forcep here. All right. Switch over, Anna. I'm gonna end with you, okay? Who wants Alice to get in this ringer?
I want to get in there.
You don't have to scrub. You don't have to scrub. Just come up.
I get the pass? I'll pass. You can be an assistant. All right.
You can break, Zoe, if you want. If you're hot.
I want to pass.
You can break too. And I'll talk to you. Don't hang that down.
Oh yeah. What the hell am I thinking?
Who's passing?
I'm passing.
You're the tech. Who's the tech? You are.
You're the tech.
I'm passing.
I'm sorry.
You are
You're my
confusing the shit
assist.
out of me.
Okay.
Yeah. Why are you yelling at me?
I'm not yelling. I'm just tired too.
I know. I'm sorry.
Fine.
All right. Let's think here. Do you know everything is?
Yes,
Are you
sir.
ready to rock and roll?
Yep, I'm
All
ready.
right, let's go. We got 2 laps of the field. All right, template.
Right away, doc. You're welcome.
Incision. All right, can I get a hemostat? Lay down.
Yes, sir. Right away, doc.
Hold that just far. Can I have a debate, please?
Yes, sir. Right away, doc.
Tying a passer or stick tie.
Yes, sir.
Tips. Take that off. That's a ball.
Right away, doc.
Take that off. I said that 10 minutes ago. Can I have a Babcock, please?
Yes, doc. Right away.
Actually, give me 2 cokers.
2 cokers? Yes, sir.
Hold that up. Can I have a blade?
Yes, sir.
Can we have another cover? This is just terrible.
Okay. Right up.
It's okay, I just need 1. Never mind.
Heard.
Leave it up just like that. Can I have a suture, please? Laid down. Suture.
Right away, doc. Oh, this is... Right? Sorry, doc. It's still way down there.
That's
that?
wrong.
I know it's...
Not watch like you. Suture.
Is it this?
Just keep going. So you figure it out.
If it's this way? Okay, so if you pass it to me, I can.
Let me show you.
Yeah, please.
I want to show you one time. So it's almost there. You did fine. So that's how it's going to be used, right? So drop it. Pick it up, right?
Mhm.
Go to your kind of chest like this. So this is going to be facing the left, the needle head. It's going to be facing out.
Okay.
And it's going to be facing out. So you just come right in, right? Click it. Your right hand, do the little choke. Take this and just kind of go vertical. Take it out of the pack. And then you can have it, right? And so that tip, like the barrel of a gun, needs to be shooting right at the doctor. So this is not loose. You want to have a good tight and kind of pull on it, right?
Yeah, hold it.
You just kind of go like that and then just follow them and drop
That's
it.
what I need practice on.
Yeah, drop it.
Sutures.
We're still waiting here. Come on. Suture, drop it. I'm going to take it off the needle handle. Yeah, there you go. All right, load that up.
Cool.
Suture, please.
Right, like this.
Okay, so yeah, boom. Am I right handed? Is it facing the left?
Yeah.
So good. So with this hand, put the choke. No, don't. Just hold it
Oh,
right
sorry.
there. Just come up here and grab this part with your little fingertips. This hand, grab this.
Okay.
Then I want you to come vertical and just come out like this and then pass it into my hand. Let's see, it wasn't locked right, but you went to that right. So really click it, make sure it's locked. Maybe a couple times, make sure it's there, right? Grab it, grab this, come vertical and just turn where it's locked and loaded. You're shooting the doctor. You don't have to go fast, just go like that, right? You're there. Just follow them along. Drop it like hot. Go.
Drop it like it's hot. Hurt.
What time is it, guys?
3:25.
Almost there. I get one more page. I'll have Paige do this. I want to finish with you so you guys see the end, and then we'll clean up, okay?
You see the,
We have a couple more weeks. Was it week 8? We'll do this again, and everyone will have a chance at it, okay? And I'll probably get, what I'm going to do is get 2 stations, so we'll both do it all together.
Take
okay?
that.
That's perfect. Good.
Cool.
All right, so let's Paige in here real quick.
Yep.
And then what I want to do is finish with
That blade's right there.
Anna again.
Yeah.
And I'm going to show you how I'm going to close it, okay? So here's a suture for you. You take that off. Get yourself organized a little bit. This is also like you guys that come in on your off time if you can.
Yeah, that's cool.
To try to get some of these skills and just work on it.
Especially a suture.
What we can do is, I know one of these weeks in the procedure class in the morning, maybe I'll bring all these things and we'll work on some basic techniques.
That'd be
bring
nice.
a couple Mayos,
Yeah.
then of course he's down here. As long as that week 10 we've got the chapters out of the way, we'll just work on more.
That's cool.
And then we come in here and just work on that final evaluation. But we'll get these suture passes and anything you want to work on, we'll do
Suture
that.
passing.
Okay?
That's what I need to work on. Those are trash.
Yeah.
Those are where they cut. Oh,
shit!
You okay? Good dude.
We're all just getting tired.
He's like,
I hear
good
you.
dude.
Get out.
Watch your suture over there.
So I don't know if we have any more Zoe. I'm not sure we have any more. I think I grabbed the last one. You got a bike roll there? There you go.
I need one. No, I'll take that. Oh wait, that's the super real.
Is it suture? Yeah. Just leave it. She's fine with that. I'm not gonna. I'll just use the one she has loaded and stuff. And eventually, I want to finish up with us doing a final count. Okay. Ready? Come on, there's Samantha.
Ooh. Yes, sir. I'm sure.
Perfect. Sorry.
And that need to go away.
Just being honest.
Alright. Good thing I can't smell.
We're all family here. You're gonna smell smells. Sometimes it might be me. Sometimes it's patient.
Not with COVID. I can't smell nothing.
Are you ready to rock and roll? All right. Good. We have a date, please.
Coming your way down.
Outstanding. All right. Got you. Just like that. Can I get a hand set? Yeah, it did. So let's get a basin over there and just lay stuff in there until I can talk to Chrissy about getting another one. Can I have a tie and a passer? First, get it to Bakey. Bakey first.
Coming your way down. Coming your way down.
Take that off.
Come your way, doctor.
Can I have a Babcock, please?
Come your way, doctor.
Can I have a free tie?
Come your way, doctor.
Can I have a hemostat first, please? Hold this.
Come your way, doctor.
Hold that just like that. Can I add a Debrief first and then a tie and a passer? I apologize.
Come your way, doctor.
Spread the Red Sea. There you
Yes,
go.
sir.
Pull up a little bit.
Mm-hmm.
Take this off. Just like that. Don't move. Don't move. Gonna get another tie and a passer to bake you first. Scissors before that.
Come your way, doctor.
I got the debakey.
Sorry.
Why are you moving? Small. Can you get this smaller next time? I'm gonna look like a surgeon.
I apologize, doctor.
Can you hold this with your teeth?
Yep.
Thanks.
Oh, shit. Shoot.
Let's see if I can tie it. See, I'm a badass.
You got it. I got
No,
faith in
I
you.
have no more ties.
Can I have a...
You can't tie that with your big fingers. Oh, wow. Do you need your assist help? Got it? Oh. Okay. Check you out.
Meredith Grey here.
Okay.
Scissors.
Come your way, doctor.
Take these off.
Yes, Doc.
Hold on.
Oh, no.
Scissors.
Come your way,
Can I
doctor.
have a curved mayo?
Come your way, doctor.
This.
Come your way, doctor.
Scissors. Off. Appendix. Dirty. Give it to the tech, please. What are you gonna do with that dirtiness? Put it into an area. What, right in your saline? Great. Good. Specimen. That's good. It's dirty. That Babcock is now dirty. What are you gonna do with that? You better find somewhere where you isolate dirtiness. There you go. All right, good. All right, so you define. I know we're running out of time, but I want to show how it's going to close. What's 333 stand for? Is that an area code?
No, it's an angel number.
Oh, it's an angel number.
He said,
So we ganked
so that's
it
my
down.
apartment number. 111.
That's your area code. Anna, we're going to come here. Who has this count sheet? So I want you to clean up a little bit because a lot of people have used it. What's going on here? Page.
You never used your ties.
Yeah, they should still have ties.
Yeah.
What do you want me to do with these?
So they can still
Let's leave it right over there. I hate those things. So remember, this is what I want to see. Where's my... What I am going to do with the final evaluation, I'm going to break. Maybe.
I thought you were going to break.
And I'm going to grab the count sheet. You hear me, Anna? Does everyone hear me?
Yes, you're going to count.
Does anyone hear me? Where's my
Yes.
count sheet? So I'm going to grab it. I'll know where it's located on a clipboard. So Anna, what I'm going to do is someone's going to be up here closing, right? So we're going to have someone closing hypothetically. They're going to have a suture. They're going to have the suture scissors up here. I might hide something. I might drop something. I don't know. You don't know anything. Right? The point is, what is the order to count? And I said, are you ready for a final count? We need to start from here
Yep.
to here to here, and we need to do it perfectly. And if you get that done, and if I have to keep doing it until you get it perfect, I will let you do this until tomorrow. But if you do it perfectly right, and then you're done. And then
You
you
got
can
this,
break
Anna.
scrub, you can celebrate, and then I'll write up an evaluation and I'll talk to you what I saw through the whole process, right? So we're going to do that. Let's do a final count. Let's do this perfect. Let's end on a high note. We're going to start with laps first, please.
You got this.
Laps.
And you need to be forceful. I need to hear you. I can't hear whispering. Laps.
Yeah.
1, 2, 3, 4, 5 laps.
Ratex, please.
Retract. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 laps.
Okay, we'll go with how many sutures we have. Let's say the doctor's up your suture, and what would you do?
1,
Okay. None on your Mayo.
1,
Okay.
2, 3, 3 suture.
3 sutures. Okay, good. Hypos.
Hypos. 1 hypo.
Okay. Bogey tip.
And then
Never took it out of here. Never used it. Never passed that off. We'll go over that later. Bogey tip. Good. Okay. Blades.
blades. 1, 2 blades.
Okay, we're gonna go with your instruments. Are you ready? How many towel clamps in total do we have?
Perforated or non?
In total, everything you have in total.
Okay. 1 on Mayo. 2, 3, 4, 5, 6, 7, 8.
8 is correct. Curved mosquitoes.
For mosquitoes. 1, 2, 3, 4.
4 is correct. Give me all Kellys all together, curved and straight.
Okay. 1, 2. 3, 4, 5, 6, 7, 8.
6. That's correct. Cokers.
Hookers. Mayo. 1, 2, 3, 4 cokers.
Okay. We'll go with Babcocks.
Babcock's. 1.
Oh, I think she has a dirty one, so make sure you know where she put it. Dirty. Don't touch it. That's dirty stuff, right? Did you put it in here or no? Where'd it go?
It's right there.
I found this one.
So how did it get there? Over here. No worries. We'll blame her. So how many Babcocks do we have? Just remember, if something is dirty with the appendix, we shouldn't be touching that anymore. Because we're still clothes, right? And you're going to give them clothes and stuff, and you got perforated, nasty, infected gloves. And it's going to cause an infection on that side, okay? So how many Babcocks do we have?
1 on Mayo, 1 on 2.
Okay, that's 2. Tonsil clamps.
Tonsils. 1.
What's wrong?
So.
1.
Let her think it through.
2.
2, okay. How about Alice's?
Alice's.
Not Alice, Alice's.
Alice. 1, 2,
We should have 4.
4. 1, 2, 3, 4. 4. 2 here, 2 on the Mayo.
Right angles.
Right angles. 1, 2.
Good. Sponge holders, sponge sticks, foresters.
Okay. You said,
Sponge sticks. Chest card. Let her think it through. Chest,
1, 2.
not chest card. How many chest cards do we have? Needle holders.
Needle holders. 1, 1, 2, 3, 4.
Outstanding. Scissors in total?
Scissors. We have 1 scissor there. 1, 2.
Start from beginning again.
3,
Start from up here. Mayo, back table. You're missing something.
1, and then 2, 3, 4.
Okay.
Good job.
Tissue forceps. How many we got in total?
Tissue forceps 1, 2, 3, 4, 5, 6, 7, 8.
Outstanding. Knife handles. Let's finish strong. Knife handles.
1, 2.
Outstanding. Total retraction.
Retractors 1, 2, 3, 4, 5, 6, 7, 8.
All right. Anything we're going to add? Doctor count is complete. Full suction.
Whole section, I have 1, 2.
We have a yank hour.
Yank hour 1.
Full suction 2. Yank hour makes 3. Count is complete, doctor. And then you're done.
Good
What was
job.
your question?
So when you said you don't touch anything with dirty, nasty gloves, so would you, at the end, I guess, like when he's starting to close, can you take off that first glove?
Yeah.
And then that way it's clean passing off?
Yeah, and then you're going to learn over time. Yeah, so it depends on what case you're doing. If you're doing something that is contaminated, it's good to have double gloves. And if I ever touch that, just like I said, I'll just take out another pair. And if you're the nurse, I'll say, hey, Jessica, give me another 7. Just get another glove on, right?
So it's a gross change.
Pro tip, just so you know, when you have contaminated stuff, I would have another Mayo come in. Do you see how, if I even like really anal retentive, if I knew it was going to go open, I would have a whole other Mayo with this all set up off to the side.
Cool.
And so when they're ready to go, I would just leave it on the Mayo and just switch the damn Mayo out. Because I'm ready, doc. Because I hated that process of turning over. But you need to get used to working under pressure in this scenario because that's not always, you never, sometimes you can't anticipate that. It's going to go quick, right? We got a bleeder, take this off, lights on, 10 blade. I'm cutting, suction please. That's how it's going to go. And you need to be like, okay, I need to get a blade, I need to get this to it, right? And slowly keep working and still giving them stuff. But that comes with experience. This is a good skill to have.
Yeah.
And if you can keep calm, and I think you did really well. I think I want you to speak up more. I think you're getting there. And I also don't want to hear sorry anymore. Do you know what I mean about that?
Yeah.
That what it tells me is you're like, I'm sorry. No, doctor, just say, come in your way, doctor, and correct the problem. And then later on we can talk about, trust me, I can talk to you about all my problems and all the things I've did before. But in the OR room, come in your way, doctor, no problem. Boom, even though I fucked up. You know? I had a doctor say, don't say sorry to me one more time. And right off the bat, I said, oh, sorry. You know, it's like, because I know, I feel you. I want to say that. I feel like, oh, I screwed it up. So do it. Are we good?
Yeah.
All right, I'm going home.
Bye.
So what I want to do, anything that's laparoscopic, you can break. Because I know you're hot and tired, and you did really well. Okay, and I'll talk to you in a minute. I want you to break anything that's laparoscopic. Lay it over on that table over there, and I'll take care of it.
On the back one?
On that back table, camera cords, anything that needs to be re-wrapped up, Trocars, anything that's laparoscopic. What we need to do is, Anna, get a little drink, use the bathroom, and please do. But we need to help her get her tote all ready to go. And if we can do that, we'll get out of here early, okay?
Grab all the stuff that we needed to open up.
Outstanding. Yes, please. Yeah, I'll take care of that. And whoever wants, next week,